Ugh, I'm so pregnant. Okay, so maybe being pregnant isn't really applicable to most college students right now, but one day it might be. Research has found that mothers exposed to high levels of fine particulate matter, aka PM 2.5s, have just doubled their child's risk of developing autism. Remember when I said it's easy to think of all the possible health effects that are caused by PMs in our air, but we'll get into that later. Well, it's later, and I'm here to explain all things air pollution and how it greatly affects you. People in Utah are extremely active, like wear Tevas during the winter kind of active.
Those are sports sandals.
And in March, it's not weird to say that you're going skiing and golfing in the same day. However, being active means that we're constantly outside, and because of this, we're breathing in all the gunk that's in the air.
Ew!
As we learned last time, since we have PM 2.5s, aka super tiny specks of dirt and whatnot, they're easily inhaled and can become embedded into your lungs. Some Utahns only experience a sore throat and tend to feel sick more often than usual during inversion months. But others experience aggravating symptoms related to asthma and can even develop lung disease like chronic obstructive pulmonary disease, also known as COPD. This is terrifying because in 2014, COPD was the third leading cause of death in the United States. And we are at a high risk of contracting COPD just because of the inversion.
That's fact.
Not to mention, Utahns are at a high risk of developing pneumonia too. According to University of Utah Health and Intermountain Healthcare, the inversion sent more than 200 people with pneumonia to the emergency room last year. In addition to your lungs, research has shown that inversions and air pollution are commonly linked to heart disease. In Utah, 1 in 4 deaths are caused by coronary heart disease, making it the leading cause of death. Plus, a research study at University of Utah Health found that women living along the Wasatch Front had a 16% higher risk of miscarriage following short-term exposure to increased air pollution. Short-term exposure meaning like a few days.
Oh my God.
Oh, and I'm not done yet. As of 2018, the Center for Disease Control and Prevention, also known as the CDC, stated that in the United States, 1 in 59 children have autism by the age of 8. But in Utah, that ratio is 1 in 40 children, putting us at the top of the list of states with the highest rate of autism. Now, while there's not a direct correlation between autism and poor air quality yet, there definitely seems to be a link, which is why the University of Utah, along with Vanderbilt and Johns Hopkins University, were asked by the CDC to participate in the Autism and Developmental Disabilities Monitoring Network, where they will monitor children with autism over the next 4 years to see if there is a direct correlation.
That's kind of fun, kind of cool.
All right, so if your chances of getting autism, asthma, COPD, lung disease, pneumonia, heart disease, or even having a miscarriage increases just because you're breathing, there must be something in the works to save us, right?
Man, someone help me.
There are a few regulations and taxes placed on automobiles, but it's not enough to push commuters to use public transit. Aside from that, there's nothing else that's really being done. So I pose the question, what are you going to do about it? Thank you so much for watching this episode of View from the U. Hey, do you know what happened last year when President Trump visited Utah and he was talking about bear's ears and Grand Staircase Escalante? We'll find out next week when we do a deep dive on everything that happened. Until then, I'm Lexi Hogan.